2/3 of people are diagnosed when the cancer is located only in the kidneys. Now for this group, the 5-year survival rate is 93%. Now if the kidney cancer has spread to the surrounding tissues or organs or even the regional lymph nodes, the 5-year survival rate drops down to 71%. Now there have been several ways or drugs have been used to manage such cases, and all these have been adopted. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and I am going to talk about a drug that is called everolimus, which is commonly given after resection of kidney cancer. In a study of patients with high-risk renal cell carcinoma, those who took the drug everolimus daily for up to 1 year after their surgery lived longer without their disease returning than those who did not take the drug. Now, improvement was seen primarily in patients with very high-risk disease, while patients who had an intermediate risk disease saw no improvement as such in their recurrence-free survival. The results are taken from the Everest study that was presented at the 2022 annual meeting of the American Society of Clinical Oncology. The Everest trial that I'm going to talk about today enrolled patients who had been diagnosed with intermediate high risk or very high risk renal cell carcinoma, and all those who had their cancer surgically removed by a partial or a radical nephrectomy. The study randomized close to 1,545 patients. Of these patients, to a year of either everolimus, a 10 mg pill which was given daily, or a placebo which was starting within 12 weeks of their surgery. The Everest patients with very high-risk disease who took the drug saw 21% improvement in the recurrence-free survival, whereas the recurrence-free survival for essentially unchanged for those in the intermediate group. Adverse effects also, such as oral mucositis, led many patients to discontinue the treatment in between. While on the everolimus arm, 37% of the patients stopped their treatment because of adverse events they were constantly experiencing. In fact, only 45% of the patients in the everolimus arm completed all 54 weeks of the study treatment, compared to 69% in the placebo arm. The researchers noted that in spite of more dropouts, they still observed favorable results for everolimus, which brings into question the duration of adjuvant therapy that is actually needed. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.